what if the tiny pill you take every single morning to prevent pregnancy, or, maybe just to keep your skin clear, is actually artificially aging your most intimate tissues by like 30 years?
Yeah, it sounds like a massive exaggeration.
Totally. It sounds like clickbait.
It does.
Hmm.
But when you actually look at the physiological data, the cellular changes happening in, say, a healthy 25-year-old on certain birth controls, they look strikingly similar to someone who has just gone through menopause.
Which is just wild to think about.
It's a really startling comparison when you view it under a microscope. I mean, the visual evidence of what synthetic hormones do to mucosal tissue is undeniable, and yet it's so rarely communicated to the patient.
Right. Which brings us to why we're here. Welcome to the deep dive. Today's mission is tailored specifically for your curiosity about a side effect that is, frankly, almost never discussed in that super quick 10-minute doctor's consultation.
Yeah, they really just gloss right over it.
Exactly. So we are looking at the physical impacts of hormonal contraception, and we're zeroing in on one core question for you today. Can stopping contraception actually change vaginal tone or lubrication?
And to answer that thoroughly, we're pulling from a pretty massive stack of source material
It's
today.
a huge stack.
Yeah, we've got clinical guidelines from the UK NHS, and that's the National Institute for Health and Care Excellence. We're also looking at position statements from the British Menopause Society.
Plus some really cutting-edge clinical research on the vaginal microbiome.
Exactly.
Yeah.
And data on pelvic floor physical therapy, and even, the actual efficacy of those heavily marketed energy-based laser devices.
Okay, let's unpack this, because if you go to a typical appointment to get a birth control prescription, the conversation is usually pretty standard.
Very standard.
Right. You talk about preventing pregnancy, maybe the potential for mood changes or weight gain.
Usual suspects.
Yeah. But the changes to intimate physical health, specifically moisture, tissue elasticity, and the actual tone of the area, those are just completely glossed over.
Often completely ignored, honestly.
And if you bring it up later, you're often just handed like a generic flyer about using more lubricant.
Which, can feel incredibly dismissive to a patient who is struggling.
Oh, absolutely.
We really have to establish a foundational truth here before we dive in. Hormonal contraceptives fundamentally suppress your body's natural endocrine system.
Right. They basically hijack it.
Exactly. They override the natural communication between your brain and your reproductive organs.
Mm-hmm.
So naturally, stepping off of them initiates this huge physiological reboot.
Which is a lot for the body to handle.
It is. But to really understand the reboot, we first have to look at the suppression itself.
Right. Before we get into what happens when you start, let's figure out how, a tiny pill or a small patch manages to completely dry out your skin and your vagina in the first place.
Yeah, so the mechanism centers heavily on estrogen and testosterone. Methods like combined oral contraceptives or the patch or the vaginal ring, they work by basically flooding the body with synthetic hormones.
Which tricks the body.
Exactly.
Yeah.
This constant flood signals your brain to just stop producing its own natural circulating levels of estrogen and testosterone.
The brain is just like, oh, we have plenty down here. We don't need to make any.
You got it. Now, natural estrogen is basically the primary architect responsible for keeping vaginal tissue plump, highly elastic, and, naturally moist.
Okay.
It actively promotes blood flow to the capillaries in the tissue, which literally keeps those cells hydrated and functioning properly.
But looking at the sources, it seems like it's not just the sheer drop in natural estrogen that's causing all this dryness. There's like a secondary mechanism happening in the liver.
Yes, and this is crucial. It involves a protein called SHBG, sex hormone binding globulin.
Okay, SHBG.
When you take oral contraceptives in particular, they have to be metabolized by your liver. This process, which is often called first-pass metabolism, basically triggers the liver to significantly ramp up the production of this SHBG protein.
So the way I kind of picture this, and tell me if I'm off base here, SHBG acts like a fleet of microscopic hormonal sponges.
I actually love that analogy.
Right. So the liver pumps out all these little sponges. They float around in your bloodstream, and their only job is to soak up your body's free testosterone.
That's exactly what they do.
And because free testosterone is actually so crucial for female arousal and blood flow and natural lubrication, this massive sponge effect just leaves the tissue feeling completely desert dry.
The liver mechanism is incredibly efficient at doing exactly that, yeah. And what the data adds to that analogy is that These SHBG proteins bind so tightly to the testosterone that the hormone actually becomes biologically inactive,
Oh, wow. So it's not just soaked up, it's basically locked away.
completely locked away in a vault. And if we connect this to the bigger picture, the cascading side effects we see in young, otherwise completely healthy premenopausal women on the pill, they actually mimic a recognized medical condition called GSM.
GSM, genitourinary syndrome of menopause. This is the part that genuinely shocked me when I was reading through the sources.
It is shocking.
We are talking about 20-something women experiencing the exact same cellular tissue changes as a postmenopausal woman. Like, how does that physically manifest?
So GSM is basically driven by an absolute deficit of estrogen. Without it, the tissues of the vulva and vagina literally atrophy.
They just thin out.
They do. They lose their collagen matrix and their elastin fibers. The vaginal epithelium, which is the protective surface layer of cells, becomes really pale, friable, and just super fragile.
Friable meaning it just breaks apart easily.
Exactly. It loses its ability to expand and stretch naturally, meaning it can tear and bleed easily, particularly during intercourse. Yeah. So when birth control artificially induces this really low estrogen, low testosterone state, it triggers identical symptoms. Chronic dryness, micro-tearing, stinging, and just persistent irritation.
That is just wild. And honestly, if you're the one experiencing that stinging and tearing, it's terrifying.
Absolutely terrifying.
So naturally, the thought process for you would be, I need to get off this medication immediately, which leads us to the rebound effect.
Right, the reboot.
If the pill is acting like this giant fleet of hormonal sponges, does just throwing the sponges away fix the problem overnight? Like, you stop taking the pill, the estrogen comes back, and suddenly the desert blooms again.
I mean, we wish it worked like that. But the physiological reality is much slower.
Yeah.
Discontinuing the pill definitely allows the hypothalamic pituitary ovarian axis to wake back up. But
Hey, hold on. I need to admit some confusion here, because hypothalamic pituitary ovarian axis is a mouthful.
it is a bit of a tongue twister.
Can we ELI5 that? Like,
Yeah.
explain it like I'm 5. How do the brain and the ovaries actually talk to each other?
Sure. Think of it as a chain of command. The hypothalamus is a region in your brain that acts kind of like the CEO of a company.
Okay, the CEO.
It releases a chemical messenger telling the pituitary gland, who we'll call the middle manager, to send an active signal down to the ovaries, which are the factory floor.
So CEO to middle manager to the factory.
Exactly. That signal tells the ovaries to mature an egg and produce estrogen. But when you are on the pill, the synthetic hormones in your blood basically tell the CEO, hey, we have plenty of product, shut down the factory.
So the CEO stops sending messages.
The CEO stops sending messages, the middle manager goes to sleep, and the ovaries basically stop working entirely.
So then when you stop the pill, the CEO has to wake up, realize the synthetic hormones are gone, and start shouting down the chain of command again.
Precisely. And that adjustment period, where the communication lines are slowly being reestablished, is medically referred to as post-pill syndrome.
Post-pill syndrome. Okay.
Your body essentially has to remember how to produce, regulate, and balance its own hormones from scratch.
I want to push back on this timeline a bit, though, on behalf of anyone listening who is currently dealing with painful intercourse.
Of course.
Because hearing a doctor say, well, the recovery is rarely instant, just give it time, is incredibly frustrating. What does the clinical data actually say about how long we are supposed to wait for this factory to come back online?
That's a very fair question.
Mm-hmm.
The sources give us very clear, stratified data based on the specific delivery method you are using.
Okay, so it varies.
It does. When you stop, most people experience what's called a withdrawal bleed within 2 to 4 weeks. But we have to be really clear here, that is just a chemical withdrawal from the synthetic hormones leaving your system.
Right, so that's not a real period.
No, it is not a true menstrual cycle driven by ovulation.
Okay, so the factory hasn't actually started making its own product yet. It's just kind of clearing out the warehouse.
Perfect way to put it.
Mm-hmm.
For true ovulation and your natural hormone cycles to fully normalize, which remember is what brings back your natural estrogen and tissue moisture, you are looking at a much longer wait.
Like how long?
Well, the data shows injectables, like the Depo-Provera shot, take the absolute longest. It routinely takes 5 to 8 full menstrual cycles for baseline fertility to return.
Wow, 5 to 8 cycles. What about the patch?
If you were using the transdermal patch, it averages about 4 cycles. And for combined pills or the vaginal ring, it takes around 3 full cycles for that brain-ovary communication to stabilize.
So we are talking about roughly 3 to 8 months, depending on your method.
Exactly.
Expectation management is absolutely huge here. If your vaginal dryness started after you went on the pill, stopping the pill will very likely solve the root cause. But
Yeah.
you really have to be patient. You're basically waiting for the CEO to get the factory running at full capacity again.
You are. And during that transition phase, those erratic hormone levels can trigger other temporary post-pill symptoms, too. Things like acne flare-ups, mood swings, or even changes in hair shedding.
Ugh, the joys of hormones. Okay, so we've established the mechanics of the moisture returning. But moisture isn't just like sterile water and estrogen,
Right.
right?
Far from it.
It is an entire living, breathing ecosystem down there. What happens to the actual flora, bacteria living in that environment when the water dries up or floods back in?
This is actually a rapidly evolving area of clinical research. In a healthy vaginal microbiome, natural estrogen plays a highly protective, active role.
In what way?
It stimulates the vaginal tissue to produce glycogen, which is essentially a natural complex sugar.
Okay, sugar in the tissue.
Right. That glycogen is deposited directly into the vaginal cavity, and it serves as the primary food source for lactobacilli, which are the beneficial protective bacteria.
And those lactobacilli consume the sugar and produce lactic acid, right?
Exactly.
Which keeps the vaginal pH incredibly low and acidic, somewhere around, what, 3.8 to 4.2?
Spot on.
And that high acidity is literally what burns off or inhibits bad bacteria from taking root and causing infections.
Yes, the acidity is the ultimate defense mechanism. When lactobacilli thrive, the environment is just completely hostile to pathogens.
Now, here's where it gets really interesting. And frankly, where I need to challenge the conventional wisdom a bit.
Well, let's do it.
We are constantly told by wellness influencers that synthetic hormones wreck your natural flora, whether it's your gut or your reproductive tract.
You hear it all the time, yeah.
But the clinical sources we're reviewing show a massive contradiction to that. They claim the combined oral contraceptive pill is actually good for stabilizing the vaginal microbiome. That just seems completely counterintuitive to me.
It definitely seems to contradict the whole natural is always better narrative, but the biochemical data is very clear on why this happens.
Okay, break it down for me.
Because the combined pill provides a steady, continuous, unchanging stream of synthetic estrogen every single day, it basically ensures the tissue provides a constant, flatline supply of glycogen.
So the food source for the bacteria never drops.
Never. That creates a highly stable, rich environment for the lactobacilli to colonize without any interruption.
Wow.
Yeah, specific strains like Lactobacillus crispatus, which are highly protective, absolutely thrive in this artificial stability. Consequently, the research shows that pill users actually tend to have significantly lower rates of bacterial vaginosis, or BV, because that acidity never wavers.
Okay, but there's a biological catch, isn't there? Because an overabundance of sugar in a warm, moist environment doesn't just feed the good guys.
No, it feeds the opportunistic ones as well. Candida, the fungal pathogen responsible for yeast infections, also thrives on a steady diet of glycogen.
Right.
So, for a subset of individuals, that continuous, unwavering hormone level creates the perfect storm for recurrent chronic thrush.
Which means stopping the pill completely changes the rules of engagement for your microbiome.
It throws it into a completely different state.
Right, because when the CEO and the factory start working naturally again, your estrogen levels are going to rise and fall with your cycle, which means your glycogen levels naturally rise and fall.
And that inherent natural fluctuation actually makes the microbiome slightly less stable. Yeah. Right around your period, when estrogen naturally drops, the glycogen drops too.
So the good bacteria starve a little bit?
The lactobacilli starve a little bit, the pH creeps up, and you might become temporarily more susceptible to a BV flare-up.
That makes sense.
But conversely, eliminating that relentless synthetic sugar supply might be the exact biological shift needed to permanently cure someone who is suffering from pill-induced chronic yeast infections.
It's a really profound trade-off. You are basically trading a biologically stable artificial environment that guards against BV for a natural fluctuating environment that might finally starve out the yeast.
Which underscores exactly why generalized advice is so unhelpful. You really have to look at the specific microbial history of the individual patient to understand how the hormonal shift will impact them.
Okay, so we've covered the moisture, the hormones, and the microscopic battles of the microbiome. Let's move from the surface environment to the actual structural architecture.
The structure, yes.
We know stopping the pill can bring back natural lubrication, but does it actually change vaginal tone?
This requires a very critical medical distinction. And it's one that the clinical guidelines from NICE and the Royal College of Obstetricians and Gynecologists are very, very meticulous about.
Because people mix the terms up constantly, right?
Constantly. The words tone and laxity are thrown around interchangeably in marketing, but they actually conflate two entirely different anatomical structures. You have the mucosal tissue lining, and you have the deep pelvic floor muscles.
I think an analogy helps visualize this. Imagine the pelvic floor muscles are like a thick woven hammock.
A hammock, yes.
This hammock is suspended across the bottom of your pelvis, physically holding up your heavy pelvic organs, so your bladder, your uterus, your bowel. The vaginal wall, on the other hand, is just the delicate fabric lining the inside of that space. So
Okay.
the real question we are asking is, does stopping the pill tighten the hammock?
The physiological answer is no. Resuming your natural hormone production will completely alter the fabric lining. As we discussed earlier, bringing back estrogen restores the collagen matrix, the elastin, and the overall thickness of those vaginal walls.
Yep.
It plumps up the fabric, increases the vascular blood flow, and eliminates that fragile, friable texture.
But it doesn't do a single thing to the ropes holding the hammock up.
Exactly. The hormonal shift does not alter striated muscle mass. If you are experiencing true mechanical muscle laxity, meaning the hammock itself is physically sagging and failing to support the organs, that is a structural integrity issue.
And where does that come from?
That kind of muscle weakness stems from mechanical stress. So, vaginal childbirth, the natural aging process, chronic straining from constipation, high-impact heavy lifting, or simply chronic sedentary behavior.
Okay.
Removing a synthetic hormone will not magically induce hypertrophy in a weakened pelvic floor muscle.
So stopping the pill repairs the thinning fabric, but we need an entirely different toolkit to actually tighten the hammock.
A very different toolkit, yes.
Which brings us to the reality of what a listener can actually do right now. Whether you are currently in that, 3 to 8 month waiting period for your natural hormones to balance out, or you're dealing with structural muscle laxity, what are the actionable evidence-based interventions? Let's start with the tissue fixes while we are waiting for the estrogen to return.
The most immediate clinical recommendations are vaginal moisturizers and lubricants. But we have to differentiate the biological mechanisms of how they work because they serve entirely different purposes.
Right. They're absolutely not interchangeable. Lubricants are strictly for reducing friction in the moment during sex. You apply them right before intercourse.
Right.
There are water-based, silicone-based, and oil-based options. But we should probably throw a quick public service announcement in here.
Oh, definitely.
If you are using latex condoms for backup contraception while you're coming off the pill, do not use oil-based lubricants like coconut oil or Vaseline.
Please don't.
The oil rapidly breaks down the chemical structure of the latex and the condom will fail.
It's a vital safety note. Now, vaginal moisturizers operate on a completely different principle. They're formulated much more like an advanced daily skincare routine.
Like a face cream almost.
Exactly. You use them regularly, typically every 2 to 3 days, completely independent of sexual activity. They are bioadhesive, meaning the polymers physically bind to the epithelial cells of the vaginal wall.
Okay.
They are designed to lower the pH back to that healthy acidic level. And crucially, they use specific osmolality to actively draw water molecules from the surrounding tissue into the dehydrated cells, providing continuous long-term hydration.
The osmolality part is key, right? If you use a product with the wrong concentration, it can actually pull water out of the cells and make the dryness worse.
Yes, which defeats the entire purpose.
Which is why the UK guidelines specifically point toward balanced products like Yes SVM or Silk, because they are formulated to match the body's natural tissue chemistry without harsh irritants like glycerin.
The biochemistry of the moisturizer matters immensely for proper tissue recovery.
Okay, so moisturizers act as a bridge to repair the fabric lining while we wait for the ovaries to wake up. But what about the muscle hammock?
You're right, the hammock.
If hormones can't fix the laxity, what can? Because if you spend 5 minutes online, you are bombarded with marketing for high-tech laser treatments.
Oh, everywhere.
You see ads for fractional CO2 lasers, radiofrequency devices like Empower RF or Mona Lisa Touch. They charge thousands of dollars and promise to fix laxity, restore tone, and rejuvenate the entire area. What is the actual science behind these energy devices?
The science essentially relies on cellular trauma.
Trauma.
Yes. These devices work by delivering fractional heat, basically controlled thermal damage, deep into the vaginal tissues. When you intentionally burn or heat the tissue to a specific degree, it triggers the body's natural wound healing cascade.
Okay, so the body rushes to fix it.
Right. Fibroblasts rush to the area and they lay down new, tightly wound collagen and elastin to repair the thermal damage.
So it's essentially the exact same biological mechanism as microneedling or laser resurfacing for the wrinkles on your face. You damage it so it builds back thicker.
The biological principle is identical. And because of that newly deposited collagen and the temporary tissue swelling from the inflammation, some patients absolutely report an improvement in lubrication and a subjective feeling of tightness.
But there's a however coming.
There is a big however. When we look at the NICE guidelines, they explicitly do not recommend these energy-based devices for the routine treatment of vaginal laxity.
Why the hesitation from the medical boards, though? If it forces the body to build collagen, shouldn't that solve the problem?
Because building collagen in the mucosal lining does not equate to building striated muscle strength. We go back to our structural analogy. Heating the tissue to create collagen is like trying to fix a sagging roof by painting the ceiling.
Ooh, that makes perfect sense.
Right. The paint might look fresh, the surface might feel firmer temporarily, but the load-bearing beams, the muscles, are still weak and failing. Furthermore, the clinical evidence for the long-term safety and durability of repeatedly inducing thermal trauma in vaginal tissue just isn't robust enough yet to warrant routine recommendation.
So if lasers are just painting the ceiling, how do we actually reinforce the structural beams?
The absolute gold standard, backed by decades of clinical efficacy, is pelvic floor physical therapy.
It's always the low-tech hard work option that actually gets the job done, isn't it?
It usually is. It requires effort, but it addresses the root physiological cause. And it is far more sophisticated than just telling someone to do Kegels at a stoplight.
Thank goodness.
Yeah. A specialized pelvic floor physiotherapist will assess the hammock to see if the muscles are actually weak or if they're actually hypertonic, meaning they are too tight and unable to relax, which can also cause pain and mimic laxity.
Oh, wow. I didn't even realize being too tight was an issue.
It's very common. And they use clinical tools like biofeedback sensors, where you can literally watch a screen to ensure you are contracting and releasing the correct internal muscles. They might use weighted vaginal cones for progressive resistance training.
So it's literally physical therapy, just like for a knee or a shoulder.
Exactly. It takes time, usually a dedicated 3 to 6 months to remodel the muscle fibers, but it fundamentally restores the integrity of the pelvic floor.
We have covered a truly massive amount of ground today. We've gone from the liver pumping out SHBG sponges to the HPO axis waking up the ovarian factory, to the microscopic pH battles of the microbiome, and finally the structural mechanics of the pelvic floor hammock. Let's synthesize this for everyone listening.
They'll do.
If we boil the clinical data down to the core takeaways, yes, stopping hormonal contraception can absolutely improve vaginal lubrication and tissue elasticity. It removes the synthetic suppression, allowing your body to produce its own estrogen to plump up the vaginal lining and natural testosterone to drive blood flow and arousal. However, you have to be patient with your biology. You are navigating post-pill syndrome. Your brain and your ovaries have to relearn how to communicate. And that axis can take anywhere from 3 to 8 menstrual cycles to fully reboot, depending on the specific method you are using. Furthermore, if your issue is truly mechanical, if your pelvic floor hammock is weak shifting, your hormones won't fix it. You need targeted progressive physical therapy.
It really highlights how astonishingly complex and interconnected the female endocrine and structural systems are. This raises an important question: what stands out to you? When you listen to this breakdown of SHBG, the delicate balance of the microbiome, and the distinct physiological differences between tissue thickness and muscle tone, how does it change the way you interpret the physical signals your own body has been sending you?
It makes you rethink the entire paradigm, doesn't it? So what does this all mean? We have been conditioned to view hormonal birth control purely as a highly effective utilitarian tool, a switch we flip to prevent pregnancy or manage heavy periods. But if our natural hormones act as this vast, complex, full-body communication network dictating everything from the microscopic bacteria guarding our immune system to the physical architecture of our tissues, what other subtle systemic messages might our bodies be trying to send us when we finally clear the artificial static and let them speak freely?